Michael Yang to address some concerns or comments regarding local, state, and international concerns or issues. Michael Yang.
Good evening. My name is Michael Yang. I would like to thank Mr. Yang, Governor Yang, for inviting me to be here. Regardless of the turnout, I think that you and your committee did a tremendous job of getting this place ready for all of us to come here. And for that, I'm grateful for the opportunities. I was asked to share with you key issues and elements that are important to the Hmong community, that impact our community from ground zero to where we are standing right now. And I hope that you will allow me the opportunity to share some of these key points for your considerations. As you know, the Hmong community played a vital part in the vitality of this community here in the state of Minnesota for the longest time. St. Paul is home to the largest Hmong community in the nation. We have, according to our own census, approximately between 60 to 75,000 Hmong in the state of Minnesota. And with the recent arrivals of refugees from Thailand, I am assuming that I think our numbers are much more higher than what was estimated with census 2000. I would like to outline some of the key issues for you, and I hope, and I would like my elders to forgive me to speak English for the benefits of all guests. It is our hope that we will continue this dialogue with you. This is part of the Hmong community's, I think, effort to meeting the policymaker decision series, that we will continue to meet with policymakers and individuals running for public office from any party, any candidate, and at any given time that you would like to meet with us. And thank you for this request for us to also hear and share this with you. Jobs and employment skills development, this is one of the key elements in the Hmong community that impacts our family tremendously. You know that job is one of the things that keep a roof over a family. And without a job, then we have housing issues. And so job for all of us is a key issue. We talk about job creation. The president talked about job creation, but there has not been job out there. A lot of people have been laid off, including myself, for a year and a half. And so job and skills development are a crucial component in the issue affecting the Hmong community. Refugee assistance. We recently have families who are from Thailand who need immediate and desperate needs for help, financial help, and resources within the city and the county to help them move and become better in what they do, especially in job retention, so that they can move out of poverty. Health disparity. This is a major problem. Health disparity, you know, and I know, that has been a huge issue out in our community for a long, long time. I will go in a little bit more detail on that. Elderly programs. The Hmong community have a lot of our elderly. It is our privilege to still have a lot of them with us, and we would like to have additional program dollars earmarked by the state legislature in the county and the city to provide different type of services to our elderly. Affordable housing. As you know, the market is crashing, and housing is a major issue that impacts all of us. Child care is another piece. Transportation. We're looking at adult basic education, GED, or citizenship and youth empowerment, especially youth empowerment after school program for our youth. We're looking at higher education too. As you know, in the future, research has indicated in the next 5 or 10 years. Right now, it's a BA, bachelor degree, minimum requirement. In the future, it's going to be a master degree for minimum requirement. Right now, a lot of jobs are preferred, livable wage, prefer a master degree, a graduate degree. These are key elements and key issues that are impacting our community. I would like to go a little bit more in details on each of this. Housing, regarding housing. With the national housing crisis, starting in 2007, home closure hit nationally an 18-month high in the first quarter of 2010. This has a tremendous impact in the foreclosure within our Hmong community. A lot of our families are cramping into a single home, 3 or 4 families. This is a major issue. Even NPR and the Minnesota Housing Partnership indicated that jobs, declining incomes, and jobless are key factors in the housing market right now. I can tell you that unable to readjust a lot of our mortgages, families are coming together, living together with 2 or 3 different families that are cramping apartments and houses. The other issues is veterans benefits. As you and I know, the Hmong community played a vital part in the U.S. war against communism in Southeast Asia in the 70s. Many of our elders, including my father, was recruited to fight in the U.S. Secret War in Laos for America, to stand behind America so that the United States don't have to send their own troops into Laos. And now we have approximately, if my data are correct, about 10,000 left of our veterans. And what we would like to see happen is for us to allow our veterans the right to be buried at national cemeteries and have a military burial. That's one of the things that we're asking the state. And I hope that the state will follow. Congress already talked about this issue. It was presented at the floor. Both of the House and the Senate has been talking about this. So it is my hope that you guys here at the state legislature will take some lead on that. I mentioned earlier about jobs. Unemployment in the U.S. has risen dramatically since the economic recessions in 2007. Job loss rate climbed up from 5% to 9.5% through June of 2010, this year. Within our Southeast Asian community and nationwide, 3.7% to 7.7%. That's what's going on. Asian Americans have the lowest job rate, although we have the lowest job rate, although reported by the U.S. Department of Labor, 2009, that Asian Americans have a disproportionately high percentage of paying position with a graduate degree. Regardless of all of this positive movement, the Policy Institute in Washington, D.C. indicated that Asian Americans are still greater at a greater disadvantage to our counterpart, white workers. That's an issue. It's a huge issue in the job market. New York City and the College Board reported that more than half of Hmong adults here in the state of Minnesota and across the nation never had finished high school. So if you don't finish high school, you don't have a degree, you cannot land a job. As political refugees, the Hmong have encountered tremendous and impenetrable poverty. This is adding to job loss. Low-income job, unemployment, and crimes and violence, these are some of the major things that impact the job sustainability within our community. The National Coalition for Asian Pacific American Community also talked about unemployment claims filed by the Hmong and Southeast Asian groups, that in Minnesota it leaped by 150% from 2007 to 2009. 150% within that 2-year time frame. Hmong Americans in Minnesota has an immediate need for your leadership to focus on job creation and also to earmark specific dollars to our nonprofit organizations so that we can do training, job skills, interview skills, working with employer in partnership with our community to put people in jobs. I want to say this. Our people want to work. We do not want to depend on public assistance. Please, do job creation. Health disparity is a major problem too. Despite continued advances in health care and technology, you and I think, understand the racial and ethnic minority continue to have one of the highest rates on diseases, disability, premature death in comparison to non-minority community. Nationally, the Asian American and other minorities have higher rates of infant mortality, cardiovascular diseases, diabetics, infections, cancers, and other areas that we cannot even have the services for within our community. According to the National Healthcare Disparity Report by the Agency for Healthcare Research and Quality, Asian American receive poor quality care than white. For 30% of 7 of the 22 core measures that they track and service, 32%. According to the Minnesota Office of Minority and Multicultural Health, Asian American have 53% of all incidence cases of hepatitis B, the highest among all population in the state of Minnesota. Asian American of all ages are less up to date without immunization than whites. 66% of Asian children were up to date with immunization at 24 months in comparison to 85% of whites. So that disparity is a huge problem. Teen pregnancy rates for Asian American from 15 to 19 years old are nearly 3 times of that of whites in the state of Minnesota. Asian American refugees and immigrants suffer from untreated mental illness, such as post-traumatic stress disorder, depression, especially those who are victims of war. The Hmong community is the largest ethnic group among Asian Americans in the state of Minnesota, and we have the lion's share of the health disparity problem. According to the Agency for Healthcare and Research and Quality, here are 2 factors that they indicate in terms of health disparity. 1, inadequate access to care. 2, substandard quality of care. So barriers to care result from economic, geographical, linguistic, and cultural, inherent, financial, all of these related to health disparity. Incongruent, the Office of Minority Health and Bureau of Primary Health Care and Management Science for Health reported that the underlying causes of health disparity are income and education. And these are 2 areas that the Hmong community would like to see some type of leadership, some type of political will, some type of structural bipartisan support to lead and address. Inequity in income and education underlie many health disparities. Income and education intrinsically relate, and they serve as proxies to measure these outcomes. Community with the highest poverty rate and the least education suffers the worst health status. That is a given, and I appreciate you're coming here to hear this. And the other piece, disparities in income and education levels are associated with differences in the occurrence of death, illness, including heart disease, diabetics, obesity, elevated blood level, and low birth rate. These are key elements of issue impacting our community that I would challenge your leadership to take it back to your party, to take it back to your elected official, people who are representing your party, running for public office, who would like to have the members of the Hmong community consider voting for you. We would like to see some leadership of some of these core elements and issues that are impacting our community. With that said, I want to thank you again for making this request for us to have a dialogue for you to hear. I'm not sure why in the past, perhaps this may be one of the rare occasions where members of the Hmong community can speak directly to your party and people who are running for to represent your party at the state legislature as well as with the governorship. So with that, thank you very so much.
Thank you, Michael, for your comments or concern regarding the Hmong community. I'm surprised. I didn't know that we have so many concerns or so many issues. But reality, I think we're just like every other communities here in America, that we have needs and we have concerns and we need improvements. And once again, thank you.